This presentation on neuroplasticity is about the fact that the brain changes in response to stress and that it can be changed back or reversed. That discovery is essential in your clinical understanding of what happens to your clients and how best to treat them, given all treatment options and possibilities. When clients are told about this, they respond so positively. They realize there's nothing wrong with them. They are not deficient. They are not lacking of anything, but their brain has changed because of toxic stress. And that's why they experience unyielding anxiety or vapid depression. This is a message of remarkable hope and optimism for your clients because when they understand this, they can see a path forward toward healing, toward re-entering life in a way not frozen by fear or blunted by depression. This is incredibly good news for your clients. So neurogenesis, as we talked about, neuroplasticity is a word that means the brain can change due to environmental conditions, and especially in terms of toxic stress. But to be clear, the first time I ever even heard about anything like this is when I saw a TED Talk on neurogenesis. The whole idea of neurogenesis got me going on this. Been researching now for maybe 10 years and teaching this class now for several years. Also, using it in my practice every single day, this knowledge and understanding. But again, it started with a TED Talk by Dr. Sandrine Thoré. It talked about neurogenesis in the hippocampus. I never heard about that. And it talked about a correlation of building new neurons and new connections with a reduction of symptoms. So first of all, I had no idea that neurogenesis happened. I thought we were born with a certain size brain and we lost neurons, nerve cells, brain cells after a while. Nope. There are new nerve cells, brain cells being generated every day in, I think, at least two, maybe more, up to the scientists, but certainly the hippocampus every day. There's like 700 or something new neurons born or created every day. And so again, the most amazing thing as a therapist is there's a correlation of doing that, of that happening with new neurons and new connections and a reduction of depressive symptoms. Like, wow, mind blowing. And then with a lot of research found out it's because um, well, when taking medications, I'm sorry, when you take a serotonin medication, it's like fertilizing the creation of new neurons and connections, and it takes about 4 to 8 weeks to do that. There are other ways to build new neurons and new connections, but come to find out, that's why antidepressants, SSRIs, we'll talk about that later, it's why they work, because they fertilize the creation of new neurons or neurogenesis in the hippocampus. Wow, just amazing. So this slide is a representation of her TED Talk, and what I want you to do now is to pause this lecture, go watch that, and then come back. It's really, really mind-blowing and wonderful. And watch it more than once, obviously, if you ever want to watch anything here more than once. But anyway, I've watched it, initially I watched it like 10 times to be like, what? What's going on? So anyway, when you're done with that, please come back. Okay, this is to remind you that the hippocampus, as seen in this graphic, is this structure that's in the brain, but it's in two parts. It's bilateral or on both sides of the brain. It's part of the limbic system, as we talked about before. Okay, when it comes to neurogenesis and the hippocampus, scientists tell us that the hippocampus is responsible for learning, memory, general cognition, emotional and mood regulation, as well as dealing with the stress response, which is what we're interested in this class. So within the fear response, as we've talked about, cortisol bathes the hippocampus to modulate that fear response. But repeated floods of cortisol eventually cause atrophy or shrinkage. It's temporary, it can be changed back, but that's what it causes. And it inhibits neurogenesis. So cortisol, again, um, eventually causes the reduction of neurons and connections in hippocampus, and it also blocks neurogenesis or the growth of new ones. So it's a double hit to the hippocampus, which eventually causes what we term a type of depression. But it is there to modulate the fear response, and eventually, with so much of it, it will eventually shut down because of that shrinkage, and we don't have much feeling at all as humans, or Probably mammals, but certainly us humans. So again, hippocampal atrophy from stress or fear, cortisol, is related to diagnostically learning and memory deficits or difficulties, mood dysregulation for sure. It's also seen in major depressive disorder, obviously, like I just talked about, but also schizophrenia and Alzheimer's. Now, what's interesting about Alzheimer's, and there's some research, but I haven't found a heck of a lot yet. But anyway, there's some, like, a person gets older and there's less neurogenesis anyway, I believe, when we get older. But if there's not a lot of neurogenesis because of toxic stress and cortisol, then that may be contributing to Alzheimer's or that kind of dementia. So again, there's no clarity on that, but to me, it's a fascinating linkage, and I think we should know more. Now, what people describe to you when they have a small hippo, because a hippocampal atrophy is a small hippo. If they ever describe this to you, you're looking at a small hippo most likely, which is apathy and anhedonia. Apathy, like, I don't care. In fact, I don't care that I don't care. I just don't have any feeling. Anhedonia, things that used to cause pleasure, no pleasure. I may do them, I don't feel anything. And then depression. Depression in this case is like a flatness. It's not like a sadness, it's a flatness, a vapidness, an emptiness. And they'll also describe to you difficulty concentrating and learning. All those things are possible small hippo, and you want to be able to look at that, diagnose that, talk to them about that, and then suggest treatments. Whatever you do, whatever a doctor may do, etc. That's what you're looking for. This slide, I'm going to come back to this slide. I used it before in the toxic stress lecture to talk about how things happen in the brain. I just love this slide, like I told you before. So stressful and traumatic life events lead to the HPA axis activation, which leads to a cortisol release. And that cortisol release relates to or leads to amygdala increase or volume increase and hippocampal volume decrease. But then you'll notice over here this note. This is just a note on the slide. I have no idea, by the way, if the people doing the research realized that they're talking about a type of depression. I don't know, but in my research and in my practice as a psychotherapist, this is what it is. Because they said experience of chronic stress or trauma may lead to stress system blunting. That's what happens in a small hippo. Stress system blunting. It's happening for a purpose, is to calm the organism down from way too much fear response. And then all responses are basically gone. There's just person just feels emotionless. That's the small hippo. But I'm not sure if they knew that's what they're describing, but it's a big thing on that important slide to me that I'm describing to you. This slide just quickly lists a bunch of research that I found before, and I found others since then, talking about neurogenesis and depression, or that if you enhance neurogenesis in the brain, in the hippocampus, there's a reduction of depressive symptoms. Just incredible research. And again, the research out there is full of this. This is, in my mind, irrefutable, not only from the research, but also from my practice here in my office as a psychotherapist. This particular slide talks about antidepressant treatments, increasing adult hippocampal neurogenesis. That's serotonin treatments I'll talk about again in a second. But when they use certain methods and they block the neurogenesis, they found out people still remain depressed. So it really was about the SSRIs, the antidepressants, and neurogenesis to eliminate depressive or those kinds of depressive symptoms, because there are two kinds of depression that we're eventually going to talk about in this course. But that's a great bit of research there as well. Moving now to the amygdala. Again, it is bilateral, two sides of the brain, and it's this little almond size structure. That's why they call it the amygdala, almond related. And again, it's bilateral on both sides of the brain. And it is part of the limbic system, just like the hippocampus, the thalamus, hypothalamus, and some other parts. But in this class, it's all about the hippocampus and the amygdala. So anyway, it's again to remember that cortisol bathes the hippocampus to modulate the fear response. And repeated floods of that cause temporary atrophy of the hippocampus. And also, importantly, repeated floods of the same cortisol in the same limbic system also cause amygdala enlargement and hyperactivation. Amygdala gets bigger, big Amy, hippocampus gets smaller, small hippo. Cortisol does both of them because of daily flooding, monthly, yearly flooding of those regions of the brain. Now, a larger hyperactive amygdala creates a larger hyperactive fear response, or what we diagnose as generalized anxiety disorder, or GAD. So with a small hippo, there's no specific diagnosis. It's a type of depression. Like we have here with the big Amy, we have generalized anxiety disorder. We can clearly diagnose it and use the DSM to do it very, very clearly. Now, again, why does this happen? I come back to this slide. Too many lines on the savannah. So evolution shaped a brain and a brain response to constant fear. A big Amy means the person or the animal, whatever, is just more alarmed and more hypervigilant to any sort of like thing happening around them that would indicate lion and maybe certain death. So a big Amy has to happen. A small hippo will happen after a while when there's just too much flooding going on. There's just too much flooding in the brain and in the amygdala. It needs to like just calm that down so it's just not so much. And then so people can function alone and together to be safe and sound and continue living, continue existing. This slide is another slide of sort of just briefly listing a bunch of research and literature that talks about an enlarged amygdala and anxiety symptoms. And there's a lot there. There's a lot since. Again, the evidence in my mind is irrefutable, both in terms of the research and from my practice. This is especially true. A big Amy is the most common thing that I diagnosed. A big Amy, or GAD, generalized anxiety disorder, is the most common thing I diagnose. And depressive symptoms can follow that because it's depressing to live with a big Amy every single day. Now, again, we'll talk more about that in future lectures, but man, it's brutal to live with a big Amy. Okay, back to neuroplasticity and talking about healing and recovery. The role of hippocampal neurogenesis and amygdala deactivation in neuroplasticity and treatment, and therefore in a client's healing and recovery. Healing the blunted emotional response from toxic stress to the hippocampus, which creates a generalized depression. No feeling. I just don't care. I am flatter than a pancake. I just don't care. Healing the continuous fear response from toxic stress or generalized anxiety. And basically, by the way, in my observations, a big Amy is really common, happens a lot, and then way too much of that time spent with a big Amy then can go to a small hippo or smaller hippo. That's what I see in my practice. I don't find them in the research to be so clear in that, but that's what I see in my practice, is that progression. Big Amy, really common, and that can lead to a small hippo. But all of this, most importantly, normalizes your client's emotional responses to toxic stress. Trauma is its own thing, its own kind of fear response. This is a normalizing emotional responses of the brain and the person and their body and themselves to toxic stress, and to specifically symptoms of and diagnoses of what we call depression and anxiety. This quick slide is the role of SSRIs, selective serotonin reuptake inhibitors. What they do, again, serotonin in the system. So if you take a Lexapro or a Zoloft every day, it just increases the level because it blocks the reuptake of serotonin in the whole neurological system in the brain and the body. And when it does that, it does it over time, it's fertilizing the creation of new hippocampal neurons and connections in the hippocampus, which improves overall mood. A person is less flat. They actually have feelings again. They actually feel joy again. They feel much better again. And that takes a while, because it takes a while to rebuild the hippocampus. It just takes a while. As soon as someone takes a serotonin medication, that day it starts to happen. but it takes a while to rebuild it. Also, and I think you know this already, but serotonin reduces the size of the amygdala. It returns it to more typical functioning, which reduces that continuous fear response. Again, a smaller Amy is a smaller fear response and less continuous, or what we call generalized anxiety disorder. And once again, it takes a while to get there. Again, the evidence is that it just starts right away, but it takes a while to shrink Big Amy. It takes a while to build small hippo. It takes a while to shrink Big Amy. And a lot of people, their only thing going on structurally, as far as I can tell, is a Big Amy. And I tell them, just be patient. You're going to get better. You're going to get better. And I've never seen it not work. I've always seen it work in all the decades. It always works. Now, this is for a Big Amy, not for situational anxiety, not for situational depression, but generalized. Big Amy, small hippo, it always works. And by the way, it's only if necessary. Somebody with a bigger Amy or a smaller hippo or situational stuff don't need serotonin medications necessarily. It's up to them and their doctor, not us, but them and their doctor. Our job is simply to consult and encourage people to do something or whatever sorts of treatment. It's up to them what they do. But it just normalizes the purpose of antidepressants or SSRIs as to why they work and why they'll be helpful. I tell this to my clients all the time. Big Amy, toxic stress, serotonin, shrinkage, Big Amy, you feel better. And I say, stay with it, stay with it, stay with it. And within a month, they start to feel better. Within 2 months, a lot better. And that's true for a small hippo too. But the Big Amy is more typical. And man, their lives turn around. Absolutely turn around. So to finish up, not surprisingly, Big Amy, small hippo. Students tend to remember these terms more than anything else from this class because they're so simple. The nickname's so clearly stated, and my clients are the same way. I talk about Big Amy and treatment and causes and everything with clients all the time, if that's what's happened to them and that's what they've treated. And that's what they're better from. They're not feeling that anymore, that generalized anxiety, or if they got to the small hippo stage, that generalized depression. So that's those nicknames, those names are where you want to remember, like, oh, that's what we're talking about. That's what I'm seeing, diagnosing, and treating, if it's true for your client. Okay, that's it for this week. See you in the next lecture and take good care.